As I mentioned on the first day of class, working with patients with neurological injury can be challenging because they might have cognitive deficits that do not allow them to follow your commands or understand what you're saying even. So this presentation is aimed at giving you more ways to talk directly to the patient's nervous system in addition to the manual facilitation that we learned on the first day. In general, information can be put in the central nervous system through a variety of ways. The first is through proprioceptive feedback. The second is exteroceptive feedback. You can use the vestibular system to input information into the nervous system. And finally, we'll talk about other senses. The rest of the slides in this PowerPoint are talking about each of these different kinds of input and how you can use them in a clinical setting. First way that we'll talk about for inputting information in the CNS is through the proprioceptive system. First example is going to be through the use of stretch. Stretch works through the muscle spindle in the muscle itself. 3 different kinds of stretch. The first stretch is going to be quick stretch. Quick stretch is going to promote contraction of the agonist and it's going to inhibit the antagonist. An example of quick stretch would be if you're trying to activate a patient's finger flexors, then you just very rapidly push the fingers into full extension and release, and that is going to promote contraction of the flexors and inhibition of the extensors. Prolonged stretch is going to inhibit the agonist and the antagonist. Example of using prolonged stretch would be something like a diasplint, where you have the patient wear the diasplint overnight. If you're looking at, say, ankle dorsiflexion range of motion in response to even prolonged tone or some sort of contracture. You can also use weight bearing or stretching through weight bearing in a clinical situation for a prolonged period of time. And finally, you can use maintained stretch. A maintained stretch is going to facilitate muscle contraction proportionately to the load that's applied to the muscle. An example of a maintained stretch would be having a patient on a tilt table, and as you bring that patient upright against gravity, the force of gravity is going to be pulling further and further down onto the body, and this is going to promote postural extension. Another kind of proprioceptive input that you can use in the clinic is known as tendon pressure. This works specifically through the Golgi tendon organ, and it inhibits muscle contraction. Another type of proprioceptive input that is used in the clinic is vibration. Personally, I have not used vibration in the clinic, but vibration has been shown to work through the muscle spindle. High frequency vibration, defined as 1 to 200 hertz, is going to elicit a tonic vibratory response and promote contraction of the muscle. Low frequency, defined as 5 to 50 hertz, is going to inhibit the muscle through GTO. Another proprioceptive input is joint approximation. It works at the level of the joint and it facilitates extensors. I demonstrated this when we looked at sit to stand or having patients go from sit to stand. If you just put a joint approximation down through the tibia, you get extensor, knee extensor contraction. In addition to proprioceptive input, we can also use exteroceptive input. Example of this would be touch. We've already talked a little bit about the importance of hand placement for muscle facilitation. Just simply touching the right muscle can have that muscle respond, and the patient will contract whatever muscle that you're touching. Location is very important. Only use your hands when you have to and know why you're putting them in a particular place. For the exteroceptive system, you could also use icing. You can use 3 to 5 second strokes with an ice cube to help facilitate muscles. And Umfred, this information comes from Umfred, and she recommends caution with patients that have an unstable autonomic nervous system. I have personally never used icing in the clinic. Apparently, icing a patient for more than 20 minutes inhibits tone locally or spasticity locally. More ways to input information into the CNS through the exteroceptive system is through neutral warmth. You can use hot packs or warm baths, and this is going to inhibit muscle activity. This would be important in a patient with very high tone, where it would be difficult to break that hypertonia. So if you use a hot pack before you start your therapy, you might have more freedom of movement. Again, you can use slow stroking. This calms the autonomic nervous system, and 3 to 5 minutes of a flat hand over the paravertebrals. Do you remember this? Think of a mother trying to soothe her unhappy baby or an anxious baby. You just slowly stroke them on the back and they slowly calm down. Another exteroceptive system would be maintain pressure. Maintain pressure stimulates muscle activity. An example of this would be tight-fitting clothing. If you think about compression socks or TED hose that are worn in the acute care setting, you're going to increase the muscle pump. Another example would be tight-fitting clothing is going to help that system activate overall. You can also use the vestibular system to input information into the CNS. If you're looking to inhibit central nervous system activity, you could use slow rocking or slow movement, or any kind of inverted position is going to help dampen the CNS response. If you want to increase the CNS response, Umfred says anything that promotes a rapid anterior, posterior, or angular acceleration of the head while the body is prone. So an example would be on all fours quadruped, rocking back and forth. It's going to work. You can use rolling. You can use rocking on elbows alone, or you can use crawling across the floor. And finally, there are other sensors. You can use all the senses to input information into the CNS. Vision, to inhibit the CNS, you're going to use cool colors or a dark room. This is going to be important when working with a patient who is agitated or even hostile. The patient has had a brain injury. You want to bring them into a darker room, an individual treatment room with cooler colors. To activate the CNS through vision, you want to use bright colors and bright light. And vision is useful when other input systems are impaired. So a patient has problems with feeling or sensory detection, then vision is a good thing to use. Auditory, you could always use calming music or voices to inhibit the CNS and to activate it. A little bit more raucous music, or louder noises, or even clapping your hands, as a sudden loud sound is going to make you jump and activate your system. Finally, you can use the olfactory system. The olfactory system, you can use scents that are very pleasant to the patient. You can use a vanilla scent or a flower scent, or whatever the patient likes to help calm them down and get their attention.